Hello everyone, welcome to today's session where we'll explore a contraceptive device known as Liletta. As always, this discussion is designed for educational purposes. For personalized advice or health concerns, it's best to consult a healthcare professional. Description: Liletta, which is a brand name for the generic levonorgestrel-releasing intrauterine device, IUD, is used for long-term birth control. Approved by the FDA in 2015, Liletta is a small, T-shaped plastic device that is inserted into the uterus where it releases levonorgestrel, a hormone that prevents pregnancy. It is effective for up to 7 years. The device works by thickening cervical mucus to prevent sperm from reaching or fertilizing an egg, and also thins the lining of the uterus, which may prevent egg implantation. Warnings: Liletta should not be used if you have a pelvic infection, get infections easily, or have certain cancers. Less commonly, it can cause serious health problems such as pelvic inflammatory disease, PID, or perforation of the uterine wall at the time of insertion. Anyone who has unexplained vaginal bleeding or suspects they are pregnant should not use Liletta. Before using this medicine. Before considering Liletta, discuss with your healthcare provider your full medical history, especially any history of pelvic infections, uterine anomalies, or unexplained vaginal bleeding. It's crucial to confirm that you are not pregnant and do not have any current infections. Inform your doctor about any recent pregnancies, current breastfeeding status, and any previous adverse reactions to hormonal treatments. Side effects: common side effects of using Liletta include menstrual changes such as irregular bleeding or spotting, especially in the first 3 to 6 months. Some users may experience headaches, abdominal/pelvic pain, or acne. More severe side effects, though rare, include expulsion, partial or complete, of the IUD, ovarian cysts, or mood changes. If you experience severe abdominal pain, excessive bleeding, signs of infection, fever, chills, or if the device is expelled, seek medical attention immediately. Interactions: while Liletta primarily acts locally within the uterus, always inform your healthcare provider about all the medications and supplements you are currently taking. Certain medications can influence hormone levels and effectiveness of hormonal birth control methods. Dosage: Liletta is available as a single-size IUD that releases approximately 18.6 micrograms of levonorgestrel per day initially, but this decreases progressively over time. It should be inserted by a qualified healthcare provider and can remain in place for up to 7 years. Avoid: after insertion, it's advisable to check periodically that the lower end of the device is still in place through self-examination of the IUD strings. Avoid tampons and menstrual cups for the first few days after insertion to decrease the risk of infection. FAQ: many people ask if Liletta can be used immediately after childbirth or an abortion. Liletta can be inserted immediately after the second trimester of pregnancy or following a first trimester abortion if there are no other risk factors for infection. Discuss this with your healthcare provider for advice tailored to your specific situation. Closing: that concludes our overview of Liletta. Remember, this content is for educational purposes and does not replace professional medical consultation. For any concerns or queries about using Liletta, please consult your healthcare provider. Thank you for joining today's discussion.